the beginning of November today, which means it's the beginning of Movember. Now, if you've been living under a rock for the past few decades, Movember was created as an awareness month for men's health issues and trying to get blokes off their butts and to seek help when needed. So let's look at what those issues are and why they are leading to so many unnecessary deaths. Before we begin, we post death and dying related videos every Friday, so if that sounds like your kind of thing, consider subscribing to the channel. Now let's talk Movember and men's health. Movember is an annual event involving the growing of mustaches during the month of November to raise awareness for men's health issues such as prostate cancer, testicular cancer and men's suicide. It started in Australia back in 2000 and is now run in many countries all over the world, including Ireland, Canada, Czech Republic, Denmark, El Salvador, Spain, UK, Israel, South Africa, Taiwan and the USA. To quote the website, men will die on average 4.5 years earlier than women and for reasons that are largely preventable, which means that it doesn't have to be this way. Now, I tried to put everything into one video and it went forever. So this video will be part 1 of 2. So let's take a look at men's physical health issues. Testicular cancer. Cancer of the nuts is the #1 cancer affecting younger guys, the under 40s crew, and this includes teenagers. But good news, it is very curable if caught early. Now let's be real here, anyone who has blokes in their lives know they love a good old rummage in the nut area. So it shouldn't be that difficult to purposefully check them out once a week so you know what is normal for your nuts and work out if something is amiss down there. But how would you know if something was amiss? What should you be looking for? Well, firstly, jump into a hot shower and warm up those nuts so they relax and loosen up. Checking out cold nuts will be rather pointless for you and them. With your thumb and finger, roll each testicle one at a time to get to know what's normal for you. Do this weekly so you know what is normal for your nuts. If you feel any changes such as a lump, swelling, pain, you should go get it checked out by your doctor to be on the safe side. And it should be said here, just because there's a change doesn't necessarily mean you have cancer. It could be a hormone change, hernia, infection, you could have knocked them, or something medical that's painful but not a health risk. But on the off chance it is cancer, the sooner you do something about it, the better. And I've seen way too many blokes wind up in hospice because they put off going to the doctor because I couldn't be bothered, or I didn't want to know, or I didn't want some guy filling me up. Yeah, well, now you're dying and soon your family will be crying at your funeral. Suck it up and go get your nuts checked. Prostate cancer. One day you were young and spry and checking out your nuts. Then you hit your mid-40s and you can barely get out of bed without every joint cracking, and now it's time to start checking your prostate. Oh, joy! Now you can't just jump in the shower and start feeling yourself up to check for this one. Though by all means keep checking those nuts, because as long as you have them attached to you, they can get cancer. So keep up with those steamy showers. But back to the prostate, what is it? The male G-spot. Our gay mates were onto something. Anyways, the prostate is a small walnut-shaped organ. We really can't get away from nuts in this video. It's located below your bladder and in front of your rectum, and its primary functions are to create fluids in your semen and force semen through your urethra when you ejaculate. So yes, part of your fun time equipment may at some point decide it's had enough and try to take you out. Now, the problem with prostate cancer is that you usually won't have any symptoms until it's too late and very advanced, which is why you need to get it checked annually. Make it part of your annual health checkup. And yes, those are real, they're not just something in a sitcom. Write it on your calendar at the same time every year. Go to the doctor and get your blood work checked out to see if you're deficient in anything, because that can cause a variety of issues in your body. Get a skin cancer check. Get your blood pressure taken, along with checking your prostate and testicles and anything else the doctor recommends. At the same time, you should be going to the dentist to get your teeth checked and your eye doctor to check your vision, your eye health, and test for any other variety of conditions. But that sounds like a lot of work. Not if you book it in annually in advance and save the money for it. It's called being a functional, mature adult. And before you whine, it's too expensive or I can't get time off work, they've already thought of that. And with a little bit of research, you can find options that suit your schedule and budget. And remember what I said to get a blood test? Well, you'll be happy to know that that is how they test for prostate cancer. It's called a prostate-specific antigen blood test, PSA. So don't panic, you won't be on all fours or anything. As we said, you often won't get symptoms of prostate cancer until it's very advanced, so that's why you need to be proactive. But in case you were wondering, symptoms of advanced prostate cancer include difficulty and discomfort when urinating, trouble fully emptying the bladder, pain or burning when urinating, and blood in urine or semen. These are pretty clear indicators your body is giving you that something is wrong. But in saying that, these symptoms are very common in many other issues beside prostate cancer, so don't panic. Make your way at a steady pace to the doctor's office. Because even if it's not cancer, those are still symptoms that you should really be getting checked. If you're enjoying this video and finding it interesting, please show us some love and click the like and subscribe buttons. And if you really like it, perhaps consider sharing with others, particularly your mates and other men in your life. And with that, onwards. The top 10 killers. So in case you were wondering, these are the top 10 killers of Aussie men. The biggest killer by far is heart disease, followed in decreasing order by Alzheimer's, trachea and lung cancer, cerebrovascular diseases including strokes and aneurysms, chronic lower respiratory diseases, prostate cancer, blood and lymph cancer including leukemia, diabetes, colon and rectum cancer, and suicide. Now, the reason we aren't talking about the other ones is because they can happen whether you are a bloke or not. Heart disease, for example, kills almost as many women as it does men. As for suicide, we'll be talking about that in part 2 of that video in 2 weeks' time. But why do so many men not take a more proactive approach in their medical health? The scary doctor's appointment. There are many theories as to why blokes tend to avoid seeing the doctor even when they do feel a lump on their nuts. The biggest one being the generations after generations of what it means to be a man. Apparently, being a man means ignoring your problems and not facing them head on. It means not letting a doctor feel your nuts because that would be embarrassing and make you less of a man. And yet, ironically, in traditional masculinity, men are supposed to be the problem solvers. So there's a bit of a logic problem there. Now, for some blokes, this thought of going to the doctor means you're less of a man is at the forefront of their mind, but for others, it's in the subconscious. And then you would have what I and most women would consider a real man who feels a painful lump on his nuts and goes to get it checked out. Just saying. One would hope that your mates would think so too, and even if they don't, how the hell are they going to know? But there are other theories as well. Women typically do the home stuff, including making appointments and taking the kids to the doctors, and getting probed by doctors on a regular basis themselves. This means firstly, they are used to being there, and secondly, they know where to find the doctor, which number to ring, and they have a rapport with the doctor, so when something urgent comes up, it's easier to talk about. Men, not so much. Because women are the ones who need to regularly go get prescriptions for things like the pill and taking their children for regular checkups, blokes don't have the same familiarity with the doctor and the process. So being there feels like a big deal. It feels like it takes a lot of effort. And for single guys who don't have a wife to make an appointment for them, they're even more unlikely to go. This is why you need to seek out a doctor and register before you are sick or injured or lumpy. And at the very least, book in your annual checkups. If you don't know which doctor is good, you can always put up an anonymous post on your neighborhood Facebook page to ask. Get used to being there so it doesn't feel like a big deal. And who's going to know? Are your mates going to be looking through your Medicare records? I don't think so. And as far as your partner goes, there is nothing sexier than a man that is a functional adult who can make his own doctor's appointments. Google is your friend, my dude, and if you can find that niche kinky porn you want, you can find the number of your local GP too. The third theory for blokes not going to the doctor is that they don't feel ready to deal with the potential diagnosis and often tend to catastrophize the issue, such as, like we said earlier, feeling a lump in your nuts and assuming it's cancer when it could very well be a benign cyst, infection or hernia. There's still things that need a level of medical treatment, yes, but they're not a big deal. I've seen many blokes die in hospice because they didn't want to deal with knowing. And sadly, if they had just gone to the doctors, it would have been a pretty simple fix. Instead, now their family are pissed about their life choices that brought them here, and that bloke will be in the ground about a week after I saw them. Any diagnosis is easier to treat when caught early and will save you so much stress, which is not good for your heart. So next time you're having chest pains or sharp pains between your shoulder blades or feel that lump somewhere where a lump shouldn't be, remember what the weird looking lady on the internet told you? Get your ass to the doctor pronto. There are a lot of blokes out there that are on top of all this stuff, who do look after themselves by having regular checkups and seeking professional advice when needed. But many others feel the only way to look after yourself is by hitting the gym. Others are just lazy and have a she'll be right kind of attitude. That is who this video is for. Because I know these blokes in my life. Women I know have these blokes in their life, and you are stressing us the hell out. But I've also seen men die in hospice when there was no need for their diagnosis to have gone that far. So if you don't want to go to the doctor, please at least make sure that your advanced care directive and will are up to date. Stay tuned for part 2, and with that, go talk death.